Hello, I'm Hyeon Lee, the founder and the CEO of Mara Nanotech. Today, I will tell you how Mara Nanotech plans to develop and commercialize no-contact cardiovascular self-testing nano kit. According to the WHO and the CDC, heart disease is the #1 cause of mortality. Around 2030, it is estimated that 23 million people will die annually worldwide. Therefore, heart disease is an important target for early prevention. In order to reduce both mortality and medical expenses for heart disease, we need a self-assessment device for everyday life and consultation with a medical specialist. These self-assessment methods need to be not only accurate detection in very small amount of liquid biopsy, but also must be no-contact cardiac self-testing for out-of-hospital patient care. However, conventional methods require large, expensive equipment. Diagnosis of cardiac disease is made through level of troponin as the biomarker, which is found in very small concentration in the blood. Therefore, large volume of blood are needed to detect the biomarker accurately. Hence, there is a need for advanced diagnostic technique that can quantitatively detect trace up to a few picogram per ml. Nanobiosensors that solve these limitations have difficulties in commercialization due to high production cost and complicated regulation. To this end, Mara Nanotech presents a solution using nanowell array as our core technology. Nanowell can detect your cardiac disease in extremely low volume, and we can make a no-contact cardiovascular self-testing kit. The well is nano-sized space that increases the accuracy of diagnosis through measuring the response of each biomolecule. And moreover, the uniform number of nanowell array quantified diagnostic result, allowing consumers to see increase the risk numerically, thereby contributing to more precise preventive medicine. By arranging the nanowell into an array, the diagnostic signal from biomaterial are amplified. And then you can measure the cardiovascular disease biomarkers with a single drop of the blood. I proposed the nanowell array structure for in vitro diagnostic application 19 years ago, and also to overcome limitation of high production cost and the complicated manufacturing process of nanowell kit. I have tried to do various nano manufacturing methods, and I finally made it. Last year, we succeeded in 80% cost down of existing nano process cost in partnership with the National Nanoweb Center in Korea. We can help a potential cardiac patient and the medical team with our mobile nanowell kit system. As our IP status, we have 2 patents registered with 7 more pending approval. If you compared our product with those of world-class diagnostic companies, you can see that our device is cheaper and show a higher sensitivity of detecting troponin at a lower simple volume than their product. As for our marketing strategy, after the cardiac self-test kit has been developed and released into cardiovascular and the digital healthcare market, our goal is to gain 0.01% market share by 2024. As for application, it can also be used in both university and the medical research institute for development of immunosensor and the new virus diagnostic kit by replacing only the antibody probe. Here is our client and collaborator in US and Korea. As a financial strategy, Our product can be used by general consumer and also professional in hospital. And then we plan to pre-mobile healthcare service for effective marketing of heart disease kit. The team consists of experts in nanobiosensor, IT major, advisor, and the management team include cardiovascular specialists. We plan to launch no-contact self-test prototype by November of this year, and will enter the mobile healthcare market by next year. Now we are seeking $4 million in investment. The fund will be used primarily for labor cost, product, and the digital app development and go-to-market. If you are interested in no-contact cardiovascular self-testing nanokit business, please join us. Mara Nanotech was founded in 2016. We are actively working to improve and reach our goal. Thank you for listening to my presentation.